Lots of rich countries have been caught out by coronavirus. They could have taken a page from Cuba's playbook. The poor island nation is pretty well prepared so far. On average, Cubans are 7 times poorer than Americans, but their healthcare system and their history of disaster preparedness gives them some advantages in combating the crisis. So, what can the US learn from Cuba? And is Cuba punching above its weight? First, let's take a look at the stats. Cuba is a fraction of the size of the US. It's around the size of Kentucky, but 11.3 million people live there, about the same as in Ohio. But unlike the US, Cuba has a successful national healthcare infrastructure. It offers free services to all citizens. They have the highest doctor-to-population ratio in the world at 8.4 doctors per 1,000 people. That's over 3 times the US ratio of 2.6 per 1,000.
The statistics are pretty impressive when you look at kind of major metrics like infant mortality rates, life expectancy, really that mirror sort of first world developed countries in that respect. But, many medical facilities are in disrepair too. So this is very much an achievement that people value, but it certainly also reflects some of the broader economic issues that are at play in Cuban society writ large.
But despite its economic issues, Cuba has still been helping other countries out. For example, in northern Italy, it's the wealthiest part of the country, but its hospitals have been overwhelmed. In mid-March, Cuba sent a 52-strong delegation of doctors and nurses to Lombardy to help them in what was then the epicenter of the outbreak.
Miedo tenemos todos, pero hay una tarea revolucionaria que cumplir y el miedo se controla y se pone a un lado. El que ya no tiene miedo, no sé, es un superhéroe, ¿no? Y nosotros no somos superhéroes, somos médicos revolucionarios.
It wasn't the first time they'd sent a medical brigade abroad, but it was the first time they'd been sent to one of the world's wealthiest countries. A Cuba antiviral may also be central to combating the virus. Interferon alpha-2b was initially produced in Cuba to prevent a dengue outbreak, but it's had success against viruses that behave in a similar way to COVID-19. The success of the drug on this coronavirus hasn't been proven. And when comparing the US and Cuba's COVID-19 responses, Cuba arguably took rising case numbers more seriously at an earlier stage. Despite announcing a public health emergency on January 31st, less than a month later, US President Donald Trump was downplaying the virus.
You don't want to see panic, because there's no reason to be panicked about. But we have it so well under control. I mean, we really have done a very good job.
And he continued to imply later in March that the flu was more dangerous than COVID-19. The US blocked entry to travelers from parts of Europe on March 11, when confirmed cases in the US had reached over 1,200. On March 19th, the State Department issued a travel advisory warning Americans to avoid all international travel and for those abroad to return. But by that point, the US had confirmed over 15,000 cases. Some cities and states implemented their own restrictions and guidelines in that time. Now, compare that to Cuba's actions as their cases began to rise. In early March, Cuba confirmed 3 tourists visiting from Italy had tested positive for the COVID-19. On March 20th, Cuba confirmed that number had risen to 21 cases and announced there would be no entry for foreign tourists after March 24th. Cubans and foreigners with Cuban residency would be allowed to return, but with an enforced quarantine for 2 weeks at state isolation centers. On April 1st, Cuba suspended all international passenger flights and asked all foreign boats to withdraw from its waters as cases reached over 180. Even when you account for the different population sizes, there's still a huge difference.
You had Cuban parents saying you need to close the schools sooner than they did, but when they responded in a massive way. And so maybe it was late, but what's important to stress is that the response of the Cuban government owed something to the response of Cuban citizens.
Admittedly, a country the size of Cuba is much easier to contain than the US. But when looking at cases per head, the US had around 35 times the number Cuba had in early April. So how is such a small and relatively poor country set up to deal with this crisis? Well, the largest factor is Cuban healthcare. The national healthcare service in Cuba is free, universal, and in the Cuban constitution as a human right guaranteed by the state. Unlike in the US, where people need some form of medical insurance to afford care. After the Cuban Revolution in 1959, the Socialist Republic made healthcare a top priority. A hugely successful mass vaccination program was rolled out. There was large investment into community-based clinics. a lot of its funding came from economic aid courtesy of their former ally, the Soviet Union. When the communist bloc fell in the 1990s, some advantages were lost, with hospitals falling into disrepair and medicine shortages. But despite some issues with its economy, Cuban healthcare is still extremely efficient. Cuba spends around 10 times less than the US per person on healthcare. But life expectancy is the same in Cuba and the US. The Cuban system continues to focus on primary care and preventative measures, with mandatory health checks to assess individuals' risk levels.
There's a sort of a resourcefulness that exists that is a feature of Cuban society writ large that comes from having to deal with so many years of sustained economic scarcity. How do you get by with a little? How do you make a little stretch a long way? Some might view that as a kind of a scary proposition, and in some respects it is. But that resilience, I think, is something that characterizes the Cuban healthcare system and that serves it well.
Cuba's ability to provide good quality healthcare also ties into its ability to prepare for an emergency. Historically, when faced with disasters such as hurricanes, Cuba's government has a strong history of protecting its citizens.
When you have a government in a state that is still very much centralized, with kind of tentacles that extend from the capital out, everywhere, right? It is, orders from on high are listened to and executed upon, particularly in crisis situations. In some respects, what's fascinating about Cuba is that authorities are better at managing crises than they are the day-to-day when it comes to just sort of economic management.
Cuba sending doctors abroad is also not new. They went to assist parts of West Africa to help with the Ebola outbreak. They even offered to assist the US after Hurricane Katrina in 2005, but were turned away. But the international export of Cuban doctors doesn't come without controversy. Under the Cuban national health system, doctors sent abroad are government employees. So when sent abroad, the Cuban government receives a majority of the money or goods in return for their services. But the doctors sent abroad are normally paid better wages than they would at home, and often see it as a part of their social mission to serve abroad. Even though Cuba seems well prepared, this pandemic has come at an especially hard time for the country. One of Cuba's key allies is Venezuela, which faces an economic crisis of its own and can't send over as much oil as before. And then there are US sanctions. They've existed for decades, eased under Obama, and been escalated by Trump. They've had a huge impact on Cuba's economy. And finally, after medical services, Cuba's second biggest export earner is tourism. So shutting down borders and stopping flights will hit their economy especially hard.
For Cuba to say, we're going to shut the borders, we're forcing every tourist in the country to go home, and we're closing the hotels. I mean, this is an industry that is the livelihood for many, many, many thousands of Cubans. So there is going to be very severe economic pain because of this, and even worse the longer it goes.
So Cuba and the US may be only around 100 miles apart, and it's clear they've been dealing with this crisis from very different starting points. But while Cuba in the short term may be more adept at dealing with disaster, the long-term consequences may be more devastating for a country with little economic security.
Regardless of how Cuba responds and how successful it is in mitigating the spread of the virus locally, they are vulnerable to what other countries in the world do or do not do, right? If countries in Europe, which is an important market for tourists to Cuba, aren't as able to get a handle on this as quickly, there's a certain amount of this that is really out of Cuba's hands in terms of the economic pain that they're going to feel.